Today we are in conversation with Dr Glenn Laverack. Glenn, welcome.
Thank you.
Glenn, can you just tell us a little bit about your career, your background in health promotion?
I've been working in public health and health promotion now for 30 years, would you believe. Mostly in health promotion and internationally. I mean, I've worked in Africa for 5-6 years, Asia, Southeast Asia, South Asia, Central Asia, the Pacific. I did my PhD, for example, in health promotion in the Fiji Islands. I worked as an academic in Australia and in New Zealand. I've worked with Indigenous people in Australia and in New Zealand and a little bit in Canada. So I've had quite a varied health promotion / public health background at different levels, as a practitioner, as an academic, as a researcher, but also working in the NGO sector, working in the private sector, working for the UN, for UNICEF and WHO. And I guess, I guess that's given me a broad perspective on the profession.
And a global perspective as well.
A global perspective, yes.
Glenn, your work on empowerment is arguably what you're most well known for in the field of health promotion. How did your interest in the concept and the practice of empowerment begin?
Well, I've been working in health promotion for 30 years, and I worked for maybe 15 years or so, 10 years, as a standard top-down health promoter, educator, using social marketing and health communication. I think I had two very key experiences. I worked in Africa for 5 years in Ghana, on a community-based project in Kumasi. And then after 5 years there, I went straight into another very large-scale project in India, a school health project, where again I was working very much with community. And I saw that firsthand how top-down programs, here we're talking about the late 80s, early 90s, how programs were delivered, health promotion were delivered in a very top-down way, with very little acknowledgement of what the community had to offer. Certainly local capacity skills were not fully used, and I just felt there had to be a better way of doing this. And I saw firsthand where in sub-Saharan Africa, where some communities were very functional, very capable, had access to resources and money and political influence, and maybe 5 or 6 kilometers away there'd be another community which was completely dysfunctional. And that got me thinking, what is it that makes some communities more capable than others, more empowered than others, if you like? And that led me then, after those two, after 6 or 7 years, to go to Australia, where I did my PhD on this subject of looking at how we can involve empowerment into top-down public health programs. And I did my research for that in the Fiji Islands. And then after that, I worked with Aboriginal communities where I tried to apply some of these concepts.
And do you think empowerment remains the flagship value of health promotion?
I think health promotion is a principle, it's a value, and it's a practical way of working. And I think it's still valid today. And I think it's still valid because in public health and health promotion, fundamentally, we're trying to address inequalities in health. And we can't address inequalities purely in a top-down way. We have to engage with people individually, as families or as communities, to enable them to gain, as it says in the Ottawa Charter, to gain more control, take more control over their lives and their health. And this is why empowerment will not go away, because it involves working with people to give people more control over their lives. And that's why I think, how now, 20 years ago, I'd be at a conference and I'd be the only person in the room that would put his hand up and ask a question about empowerment. Now we have whole conferences about empowerment. So that, to me, shows that empowerment now is as stronger than it's ever been, I believe.
But part of the criticism of terms like empowerment is that it's used now quite casually and often quite abused in quite an abused way. What's your view on that?
Well, I think I don't think that's the case now. You see, because I think from what I've just said, I think we have better evidence that of what works in empowerment. I think empowerment is valued as and widely accepted, not just in a Western context, but in my international experience, across countries. So I don't believe, there was a period, back in the 80s, 90s when empowerment was abused and used in a very loose way. But I think now, around the social determinants of health, around our recent experiences with Ebola, for example, where it was heavily acknowledged at the end that we had to engage. The new field of community engagement, with a whole range of target audiences such as migrants. I think now empowerment is as strong as it's ever been, really. Yeah.
And Glenn, you've written a lot about health activism as well. So what relationship do you see between empowerment and health activism?
Yeah, I mean, as you know, James, I wrote a book on health activism a few years ago, and partly that was because working in public health and with this concept of empowerment, you sometimes get the sense that it is a little bit diluted. I mean, we are enabling people, but we're enabling people through education and through upskilling and through capacity building. And really, empowerment is a political concept as well as a capacity building concept. And so I wanted to look at activism and see how that related to public health. And I see it as an extension of empowerment. I see, participation and action and empowerment and activism as a continuum, really, as a sort of dynamic continuum. And I wanted to look at what tactics are used in health activism, what have been the most successful tactics. So the book I wrote wasn't meant to be a critique of what works and what doesn't work. It was really looking at what the success stories were. And there are many success stories in public health, right back from HIV/AIDS with the gay community, where they really mobilized themselves and took charge, right up to date now with Ebola and Zika, where communities are heavily involved in how we address these issues. So to me, activism is an extension of empowerment. It's just that the tactics we use that are used in activism can be legitimate, and that depends on the social cultural context that you're in. I mean, having a demonstration here in the UK, public demonstration is quite legitimate, but in some countries that would be illegal, So it depends on the social cultural context, but it's about using tactics, I think, within activism, and this is where this negative context can sometimes come in, which are seen to be a little bit on the edge of what's correct and not correct.
And you mentioned there that you see empowerment partly as being a political issue. What about frontline practitioners working in public health or health promotion? What ways can they facilitate people or communities having more power, becoming more empowered?
Well, I mean, I think it's essentially about a choice, really, a professional choice. We can choose to work with our clients in public health and health promotion, individuals, families, groups, communities, to simply try and change their behavior. Or we can make a choice as an individual and as a professional to really help enable people to take more control, to empower themselves. Now, the outcomes are the same. We're still working toward helping people to improve their health and to improve their lives. It's the process that differs. If it's a straightforward behavior change, we might be using more top-down behavior change communication strategies, motivational strategies, social marketing. With empowerment, there's a commitment here to properly engage with people, to find out what their needs are, to build their capacity, to give them some political awareness, and to let them make their own decisions. To me, that is not only the ethically proper way to do it, but it has much longer term benefits in terms of sustainability for the communities that we leave behind.
And you mentioned, Ben, that it is an investment, it is a commitment. So in today's rapidly moving society, do you think that community and individual empowerment is still feasible?
Why not? I think now even more so, because now we have very innovative approaches that we can use that we couldn't have used 15 years ago. Social media, for example, can be a very powerful tool for mobilizing and organizing people. That we've seen that through things like the Arab Spring, for example, and in the Ukraine, we're seeing this happening. Texting is now an evidence-based approach for raising people's knowledge level in sometimes quite remote and extreme contexts where it's very difficult to go, as an individual, for example. So I think now we have, more than ever, we have techniques that we can use. I mean, it depends. We have to always put this into context because, in the UK, a young teenage woman, for example, has far more control over her life than, let's say, a young teenage woman in another country, in another part of the world. So we have to put what we can do at an individual and a collective level into the context, the social, political, economic context in which we work. And here we're talking globally. So, you know, in the UK, in a westernized context, there are lots of opportunities, and in other countries, it may be more difficult. But as you know, I've written books on this subject where we can work with individuals and groups and communities, and I think in our everyday work as practitioners, we can help to empower individuals and communities. To me, it's about a professional choice. Do we want to do our work simply to change behavior, or do we really have the commitment longer term to engage with people, to help them to make the decisions, you know, in order to take more control of their health and their lives.
And empowerment, the measurement of empowerment has been problematic. And I'm just wondering if you have any reflections on how empowerment approaches can be better measured.
Yeah, I think what would help, which we don't have, let's start from that point of view to start with, is a generic set of outcome indicators for empowerment. There are lots of outcome indicators around, for example, gender issues or economic status that are being developed by the World Bank and the ILO, for example. But we need some sort of a generic set of indicators as outcome indicators. I think where the work has been, a lot of work has been done around empowerment, community empowerment, also community participation, community action, you know, these community-based interventions, is measuring the process. Measuring the process in a participatory way and visually representing those findings is, I think, where we've made most progress. And it's very important because, you know, we deliver health promotion largely as a project or a program or an intervention, so it has a time-bound aspect to it. And so it may be that the outcome of empowerment may be 7-10 years, whereas our program is only 3. So it's important that we can measure the process as well as the outcome. However, saying that, I don't think we should necessarily view empowerment as a concept as a long-term goal. I've seen it achieved in very short time frames, less than a year, 2 years, 3 years, you know, at a community level, at a family level, at an individual level, certainly. We have to see it as a continuous process and a continuous movement of goals. So we might set ourselves relatively short-term goals around getting more control in our lives as an individual or as collectively. But then we have to see that once those goals have been achieved, ideally from an empowerment perspective, we're going to realign those goals and we're going to move forward. So I think we are in a much stronger place to measure empowerment as a process. I think where the work needs to be done now is around outcome indicators, generic outcome indicators.